hip pain in children can be a warning sign or just a case of hip flu. It's important for every parent to know the difference.
Please subscribe.
Did you know that your child's hip can actually get the flu? Yes, it can. This condition, known as transient synovitis, is the inflammation of the hip joint following an infection somewhere else in the body. Dr. Boisvert, Canadian chiropractor, is here to discuss a condition that primarily affects children aged 3 to 10. Transient synovitis is the inflammation of the membrane lining the hip joint. The exact cause is still unknown, but it's believed to be triggered by a virus or possibly an allergic reaction. In medical terms, this is referred to as reactive arthritis, which is the inflammation of a joint that occurs following an infection elsewhere in the body, often in the urinary tract, intestines, or even after a respiratory infection. As a result, hip flu, or transient synovitis, tends to appear seasonally. The issue with this condition is that although it is transient and leaves no permanent damage, many of its symptoms are similar to a much more serious condition that can lead to the death of bone tissue in the hip, acetabular necrosis. This is why it's extremely important to be alert to warning signs that prompt further investigation to differentiate between these two conditions. Now, it's crucial to understand that hip pain in children alone is not a reason to initiate medical imaging. It must be accompanied by other more specific symptoms to warrant investigation. For example, if a child presents with hip pain but is also having progressive difficulty walking, especially if there is no history of trauma, injury, or sports overuse, this raises concern. Additionally, some children might complain of thigh or even knee pain instead of hip pain. A key factor in differentiating transient synovitis from acetabular necrosis is a recent or current history of fever. Furthermore, a child with transient synovitis should not exhibit generalized loss of mobility, as joint inflammation typically only causes localized pain in this case. In contrast, acetabular necrosis leads to progressive joint breakdown, prompting the body to protect the joint through spasms and stiffness, resulting in loss of mobility. It's essential to recognize that neuromusculoskeletal pain can sometimes present atypically. Therefore, a clinical evaluation that includes orthopedic and neurological tests is appropriate to better understand the extent of the symptoms and identify any danger signals that may be present in either condition. When hip pain is accompanied by other concerning signs, it may raise red flags that justify further investigation with X-rays, MRI, and blood tests. To confirm or rule out transient synovitis, acetabular necrosis, or any other condition affecting the hip, rest at home is the best approach to help your child recover from transient synovitis. However, they may require non-steroidal anti-inflammatory drugs, NSAIDs, which will be the responsibility of their doctor and pharmacist. With rest and medication, your child's hip should improve gradually within 3 to 8 days. Once the pain subsides, they can resume normal physical activities without complications. Unfortunately, the treatment for acetabular necrosis is more complex. Thankfully, I've already made a video on that topic, which should appear right now. In the meantime, feel free to share your stories, comments, suggestions, or any questions you may have. Because an informed person is in control of their health.